السلام عليكم ورحمة الله وبركاته. مساكم الله بالخير جميعا. نرحب فيكم اليوم في فعالية نفخر بها، حيث نقدم مرفق مهم من مرافق كلية الطب البحثية والتدريبية، والتي تساهم في تعزيز مستوى تعليم طبي وعلمي متميز متفرد بنوعه. الحقيقة قبل أن ندخل في تقديم الفعالية الجميلة اليوم، دعوني بداية أقدم نفسي وشيء بسيط عن وحدة الخريجين في كلية الطب. معكم مها فهد العنزي، أنا أستاذ مساعد في قسم علم وظائف الأعضاء ونائب رئيس وحدة الخريجين في كلية الطب. وحدة الخريجين هي تابعة لوكالة التطوير والجودة. ممكن نعتبرها منشأة حديثاً، لكنها الحقيقة في طريقها الواضح نحو التميز والحضور، لأنها تمثل تميزكم وحضوركم أنتم. هي تمثلكم، تمثل مستوى عضو هيئة التدريس، تمثل الطالب في الكلية، وكذلك أكيد خريج الكلية من جميع السنوات والتخصصات. الحقيقة وحدة الخريجين هي حلقة وصل بين الطالب في الكلية والخريج وعضو هيئة التدريس، حيث نحن نخلق فرص للتعاون العلمي والعملي، وهذا يشمل التدريب الكلينيكي والبحثي، وهو أساس برامجنا وأساس اهتمامنا. لهذا نحن نتطلع ونعمل دائما للتعاون معكم حتى نعرض البرامج تحتاجون وترغبون فيها. وهنا أعرض لكم وسائل التواصل معنا المباشرة معي، وأتشرف فيكم جميعا، وكذلك بوحدة الخريجين، حتى نسمع منكم إذا في والله أفكار تحبون أن نعرضها، برامج معينة، مقترحات لأسماء باحثين أطباء متميزين، فودنا نسمع منكم حتى نعرض ما ترون، سواء كان خريج أو طالب عضو هيئة التدريس. واليوم إن شاء الله بالشات I will send survey. أتمنى إن شاء الله يكون لكم وقت بحيث إنه you fill it for us، ونبدأ نعرض بإذن الله الشيء اللي ترغبون فيه أكثر وأكثر. طيب الآن انتهينا من المقدمة عن وحدة الخريجين. Let me switch to English, maybe because we have an audience that only speaks English. Today we are actually, the talk today is entitled Introduction to Basic Science Research and the Research Opportunities at the King Saud University College of Medicine. We are privileged today to have two amazing speakers, Dr. Fahad Al-Yami, who is an associate professor and a pediatric urologist. He's also the director of the experimental surgery and the animal laboratory at the College of Medicine, King Saud University. Dr. Fahad has numerous publications in prestigious journals and has done work locally and abroad. Also, Dr. Ahmed, Mr. Ahmed Taysir Al-Nazil, he's a research assistant at the center and has also published in different renowned journals and supported scientists and medical researchers across subspecialties. You are welcome to write your questions in the chat or raise your hand once, inshallah, we are done with the presentations today at the end of the talk. So the floor is yours, Dr. Fahad. I'm going to just stop the share and then you can probably share yours.
السلام عليكم، مساء الخير جميعا. Happy to be here today as part of this event. I'll give an introduction in Arabic then start the presentation in English. شكرا دكتور مها على المقدمة الجميلة، وأحب أشكر وحدة الفعاليات والمؤتمرات وحدة الخريجين في كلية الطب وكلية الطب على دعمهم لمثل هذه النشاطات التعريفية بالنشاطات الموجودة في الكلية اللي نطاقها يتعدى نطاق الكلية والجامعة، وتخدم شريحة كبيرة من الباحثين في المملكة من جهات متعددة. فحرصنا أن اليوم يكون فيه محتوى علمي ومحتوى للخدمات الموجودة عشان يكون يعني ما يملون الموجودين، ومنها أنه نضيف scientific أو جزء يعني معرفي للفعالية اليوم. I'll start sharing the screen عشان نستغل الوقت بنبدأ في المحتوى.
نتشرف فيك دكتور، يعطيك العافية.
شكرا دكتور. Can you see the slides now?
نعم واضح.
So again, welcome everyone, and thank you for being here. And in this session, we'll give an introduction about basic science research and follow that with the services that the center provides and how can we help researchers within the College of Medicine or within the university or even outside the umbrella of the university. As part of King Saud University and mission that we want to share knowledge and be part of this ecosystem and education and help researchers how to achieve excellence in research. So an introduction here that we'll be covering today various topics. We'll start with the basics of scientific methods of research, follow that with the research approaches that can be utilized, type of researchers, level of medical research, type of animals that can be used in animal models in basic science research and experimental research. And then we'll talk about the research processes within the University and College of Medicine, and we'll introduce the staff. Then we'll open the floor for questions for the audience. So as a start, we'll start with the definition here, and we'll talk about what is research, and there is various definitions are there, but this is just an example. So the first definition is a careful investigation, inquiries, special through search for new facts in any branch of knowledge. Another definition is systematized effort to gain new knowledge. It's an investigation of finding a solution to scientific and social problems through objective and systematic analysis. The purpose of all this is to answer the unknown, and this is how medicine and other science evolved. You have a question, you formulate this into an idea, you study it, you prove it, then it gets popularized and adopted by people within the field. So this is just an example to show that how experimental surgery and basic science research can help clinicians to reach to proper diagnosis, proper treatment, and even proper understanding of diseases. So this is just an example. So in the 1600s, this is where the studies started in the animal lab, where they proved blood pressure and lung function test. In the 1800s, vaccination and infectious disease. In the 1900s, antibodies and endocrine system. In the 1930s, they studied the nerve impulse and tumor viruses. And this continued to nowadays, where we in COVID crisis try to understand the disease, and we do understand the disease better, which help us to control it. So all this starts with animal research, and this is how new knowledge gets translated, where we go from the phases of the starting in the lab, then taking this further to real patients and trying to reach to a final verdict of that research track. So you start with the base. We start with identifying our question. Then we follow that with formulating our hypothesis that X causes Y or X treated Y. Then we follow that with writing a research proposal, which will include the research plan, where you have the time frames and what's the methodology, what do you need to do, how do you need to study it, how do you need to measure it, then how you analyze it and how you write it up. When you do all this, you'll have data. You have to collect that data, analyze it. Then you would interpret that data using the proper statistical analysis and using the proper tools to help you to come up with a conclusion. Then you would write your paper and share it with others. So we start with the first part, how you identify your question. You would have an idea, then you would go and read about it. So you would need sources here, and the sources could be what's written in the literature, which we call theoretical basis, professional practices, where you go and talk to people who are interested in that topic and understand it more and listen to them. Personal experience, you might have an interest in X and Y disease, and you want to make that experience even wider, and you come up with new management or even proving what's been proven before, or proving what's been proven before that's to be right, and now you prove it that it's not applicable to today patients. Then adding all this, you have to be curious. So if you're a researcher and you don't have the curiosity, then you would not reach to what you want. So you always have to have an open mind to look for other sources, even if it goes against what you believe. Then whenever you do that, you would narrow your ideas and thoughts. Then you would write it down as a research question. And that will be followed with what is my hypothesis. And usually we have two things here. You have something called null hypothesis and the alternative hypothesis. Basically, you're saying here X causes Y, X does not cause Y. And you want to prove which theory is right, and you would support that with evidence and support that with data. So then you would start writing your research proposal, and that's maybe I'm talking about basics here, and we have some people in the audience who are already a researcher, so bear with me. By the end of the presentation, we'll tell you what are the services we can provide, but I'm going from the basics because we might have people who are starting or people, medical students, so we'd like to enlighten them what are the proper research methodology that should be conducted and how they should start and how they should add this together. So you would start by writing your research proposal here. You would write the idea, what's the hypothesis, what's the methodology, you're going to study that. And here you have to read and see how others have done it. And you decide if you want to use the same way or you come up with your own way. You would decide what are the type of cells, what are the samples you'll use, what are the subjects, animals or humans, or even in vitro like cells, just individualized cells. Then you would select your sampling or collecting technique. Do you need any other sources like radiology, imaging, or lab? Then you would decide what are the data I will be collecting and how am I going to analyze that data. Whenever you put that together, now you have a research proposal. You have to review it with someone who's an expert. They can give you an insight. So sometimes you would miss things here and there. So it doesn't hurt to discuss it with your colleagues or people who are interested in the same field. Regarding the data, you have to decide what are the data I'm collecting, how accurate that data method I'm using, because you have to decide what test, because you might have different way to measure X variable. So you have to decide what's available in your institution and how accurate that, and you need to write about this in the discussion part when you write the final paper. Then you would decide what's the time frame here, how long should I take, and how long for each phase, because you should have a time planner to see that you're progressing, especially if you have a master or a PhD degree and you have to finish in a specific time. Then you would decide what's the environment I'll be studying, the animals here, and you have to discuss this with the team you'll be working with closely in the vet, in the lab, which there'll be vets who are expert in that field. So we say here it's time frame, setting, and data, which will include data collection and analysis. And having data doesn't mean you can conduct research and publish it, because you have to know what do you do with that data and is that data is relevant. So you would decide what's the methodology you would use to interpret your results, and do you need help with that or not? And the point here, when you have results, you have to answer these two questions. The first one is, does the outcome help you to accept or reject your hypothesis? And this is the main, I would say the main key element of research. Is what I'm saying right? Is X causing Y or does not cause Y? Then the second part, does my conclusion help you or help us to develop new hypotheses to explain the result? You cannot just say X causes Y. You have to support that with data, numbers, graphs, and comparing to others, other publication and other studies. The various research approach, that can be used in a scientific setting. First, the first type is problem description, where you can study causes, effect, demographics. Other type is indirect effect. Would smoking cause lung cancer in the long run? Because it doesn't cause lung cancer right away. It takes time, so it can be linked with other genetic factors. Intervention, does X procedure help to improve X or Y or decrease complication? Factor that can be can describe problem more, because you might have a new disease like COVID, so we need to know the effect and the effect of it and the long-term effect of it and its vaccine. Devices, because you might have a new device and you want to study it and study the effect on the problem itself. Behavioral assessment, and you might study the effect of X and Y environment on animals and how that affect healing, for example. Long-term and short-term studies describe problem. Sorry. Discover, find a solution for a problem, because there might be a massive literature in a specific problem, but no single paper looked at all the aspects, and you might be the one who's putting all the pieces together. You as a researcher, there are different type of researchers are there. You could be a researcher who helped to describe a new problem, a researcher who covered limitation of previous studies, a researcher who focused on gaps in previous literature and tried to investigate that and try to fill in those gaps, a researcher who studied previous studies and ensure that the outcome is valid and it fits your environment. You could study correlation and effect in X and Y. You could build a new device, and also you can focus on solutions. I will hand the mic to my colleague, Mr. Ahmed.
Thank you, Dr. Fahad, for the information. I would love to say to speak about level of medical research in lab. We have 3 medical research in lab. We have levels, the genetics level, biomolecule level, which include the polysaccharides, lipids, fatty acid, and vitamins, some hormones, and neurotransmitters. Cell level mean intracellular. We study the structure of the cells, function, and behavior. Gene level, we study the structure and function of genes. That would help to describe the problem more. Here we will speak about the guideline that conducting in research. After define the problem and read about the problem literature review and writing your hypothesis and null hypothesis, while going through these steps, you should answer the following question. First question is, how can I prove my problem? So if you are studying the diabetes, you should do like HbA1c, glucose level, insulin levels, so to approve your problem. How can I prove my hypothesis or null hypothesis? So I use X treatment for the diabetic type 1. So I need to approve that by making a comparison between the group of the treated group and the control groups. Do I meet the ethical instructions? So I need to fill the steps or following the instruction of the ethical committee. How can I illustrate my results? So I need to make a comparison. For example, I need to compare negative control with positive control to prove my model diabetic type 1, let us say. And I need to make a comparison between type 1 diabetic with a treated group. Here we are speaking about the health research types. So we have 5 types of health research. We have animal trial, vivo, and microorganism trial, vivo also. A human trial is vivo. Cell line trial, vitro. And nature of natural product, they call it in situ. Definition of animal model research. So the definition of animal, it is the investigation of a human-related condition using animal. So it's have for the following purposes: better to understand the disease process without using a human or subjecting the human for any risk, investigating the mechanism of action of a new drug or plant extraction as preclinical studies, studying the behavior of or response of such a disease. Now I'm taking a highlight for the most common animal models. Diabetic type 1 rat model. We have 2 types of models. We have the genetically modified model and induction. So for the diabetic type 1, we have we're studying also the complications. We're studying treatment for the complications like nephropathy and hepatotoxicity, neuropathy, heart disorder, mental health. For the inflammations, was sometimes like autoimmune disease, T cells, B cells, natural killer cells, cytokines, and reactive oxygen species. For the gene level, we can studying the behavior of HLA mutations and insulin gene and BTMB22 and the CTLA4. For the endocrine, we can go for ketoacidosis, thyroid disorder, spermatogenesis disruption, renin-angiotensin system for the hypertension. For the obesity rat model, we use a high-fat diet to ensure that the obesity happened. After that, we're studying the complications happen through the obesity, due to the obesity, like overload. It's caused endocrinology problems, hyper or hypothyroidism, hyperleptinemia, gut microbiota nowadays it's going for a trend, hypertension, a chronic inflammation, the response for the as a response for the obesity, overload, and apoptosis, insulin resistance, immune response. Some reproductive system have like spermatogenesis, ovulations, testicular damage. We who interested in IVF can study the obesity model. In neuropathy, peripheral neuropathy, stress, depression, and anxiety, and behavioral studies. Ovarectomy, it's a model for osteoporosis. Also, we can study the endocrinology, calcitonin, parathyroid gland, glucocorticosteroids, thyroid, hypothalamus, and vitamin D. Bone loss. Also, we can study mineral disorder, bone regeneration. For the pathway, signaling pathway, we can go for Rankel, WNT, signaling pathway, and others. For the obesity and ovarectomy, osteoporosis and obesity, as shown in the slide, we can see this paper published in 2020. They said the interaction between obesity and bone metabolism is complex and not fully understood. Dermatology models, we have skin pigmentation model. We can do wound and scars model. Alopecia, we have skin cancer model. We can study. Objectives of research. When we finish the research and publish it, we may have one of these objectives, or discover a new fact, verification fact, cause and effect relationship, and we develop this science, find a solution, solve a problem. Thank you, Dr. Fahad.
Thank you, Mr. Ahmed, for this scientific part, and we'll go back to the center here. So we provide in the center different services, and I'll be covering them in the next few slides. So as we all know, as a researcher, we have to get ethics approval, and we in the center can help you with getting the ethics approval by reviewing your proposal and making sure it's going with the university guidelines. Ideally, we should receive the research proposal whenever it's approved, but we can even help you with that whenever your papers are ready before submission to assure it's going with the guidelines. And luckily, we have two representatives in the university ethics approval board. So just an introduction about the center. It was started in 1987. It continued to evolve, and we still serve people within the university and outside the university. I'll skip this few slides because I think we should be practical to discuss research. So this is our vision. This is our mission. This is our objective. I'm not going to go over them for the sake of the time. So this is what can we do to help you. First, as I mentioned, we can help you with ethics approval documents. We can assist you with the choice of appropriate animal model that can help you with your idea. we can help you how to handle animals and also how to maintain them within animal well-being, because you'll be working with them closely. We can help to maintain the environment for you that you set up. And also we provide treatments if you need that, and also help you with animal sampling technique, and also withdrawing samples for you and teaching how to do it yourself. We can do training and professional workshops for researcher. And at the end of this presentation, we'll share with you the next planned session where it helps researchers with all the basics of animal handling and animal research technique. We can help you to review the proposal and literature review. We can help you to choose what the best animal line that can help you to answer your question. And also we can help you with ethical approval. Sampling technique. This is what I was saying. We'll suggest what are the proper sampling technique, what's the proper storage for those samples, how we should process. We can collaborate within with the labs within the College of Medicine or even the hospital to do your specific test if they're not available locally, or can help you with other outside labs. Results, we will provide you with the results at the end of your study. That will be in terms of numbers. We help you to interpret those numbers, to study the correlation and effect. And also we'll give you graphs at the end of the study to help to understand your data. And also if there is any outstanding data that we think it's not valid and should be excluded, we'll give you that advice. Then it's at the researcher discretion to exclude them or not. Also, for the publication part, we help you with the academic writing, because if you write the paper, I need someone to read it from a researcher perspective or even from animal lab perspective. We can help you with that. We can proofread your paper, and also can suggest some journals if we think that might be relevant to X or Y journal. Then I'll follow that with the introduction of our center staff that you might be working with them when you have a research. It's myself, and I have a group of very active vets that can help you and make your life easy. We'll start with Dr. Hisham Ouda. Mr. Hussein Khazim, who's admin support and supervisor with 13 experience in the lab. Mr. Ahmed Al-Mnazel, who's sharing me this session today. Dr. Majid Al-Khaybari, 6 years experience. Dr. Saleh Al-Harbi, he's another vet. Engineer Muhammad Al-Ahmad. Dr. Yasser Shwakir. Dr. Muhammad Al-Mairfi. Dr. Abdullah Al-Mubarak. Dr. Bandar Al-Hamid. I'll take you through a journey through the center just to see the facility. And as you see, we have a large team, so I'm very happy to work with that team, which can help researcher life easy within the college, and even we're happy to collaborate with others from outside the College of Medicine. So we have two parts in the lab. We have the experimental surgery, where we conduct surgical workshops, very advanced surgical workshops. And as you can see here, this is an operating room setup where we can conduct big animals and some small animal surgeries. And also we do conduct surgeries on cadavers, fresh cadavers and frozen cadavers. We also have the robotic room where we conduct robotic surgery. And this is the Da Vinci system. Then we'll move to the second part, which is where the lab is, where we do the basic science research. We have 2 big lounges and 1 meeting room that can be used for discussion between the team and the researchers. This is where we sterilize the cages. So in this area, it's you have to wear all the PPE. This is where we save the animals. And we have 2 labs. And we help to coordinate between researchers to avoid any overlap. So when you're conducting your research, you'll be on your own without any interruption. So next, I'll follow this with a workflow in the center, mainly for conducting research. So first, you have to get the IRP approval. Then you would submit your forms to us. You would review the proposal, make sure we can provide you with what you want. Then we would sit with you to discuss the research requirement. What's the timeline? What do you need? And how can you help you to provide it if we have it? And if we cannot, if we don't have it, how can we provide it from outside the facility? Then it would help you with conducting the research. Then at the end, we will give you a research completion report. We'll follow this with the animal species and models in the center. Mr. Ahmed, tafadhal.
Thank you, Doctor. We have in our center, we have animals, our animal species, and we have 1 model, Bulbsy mice. It's albino mice. And we have C57 black mice, usually used. Doctor, can you just for the next slide, please? Yeah. C57 blacks usually used for genetic background or genetic research. And we have also spring dowley rat and nude mice. This is the nude mice. We have the genetically modified mice, usually used for the cancer induction and immuno study. We have spring dowley rat used for the diabetic, type 1, type 2, obesity and overectomy and other studies. And we can provide all types of animal upon request, meeting the criteria. If you need anything, you can just contact our center, and we would love to help you, inshallah. Thank you, Dr. Fahd.
Thank you, Mr. Ahmed. I conclude my presentation here with advertising our next workshop, which basically a more of hands-on, theoretical and hands-on workshop, which will covers the principles of basic science research. It's a 3 days workshop, which will help you with what are the types of animal, proper handling of animals, proper way of dealing with them, and how to take specimens and samples, and also it will include hands-on sessions with vets, which can help you to acquire all the skills you need before you conduct your research. The dates to be confirmed yet with the College of Medicine, but this is our tentative date, and we'll advertise it in the College of Medicine website and also social media. Also, I would like to welcome the board of vets with me today, which will be able to answer researcher questions as I present them, and they will be all attending and answering your questions. The mic is to you, Dr. Maha.
كل الشكر دكتور فهد ودكتور أحمد يعطيكم العافية. Amazing talk. We are so proud to have this center in our college. This is a privilege for all of us, not only the scientists, but also all the medical researchers. And you can see that, or I can see actually, that you have given service in animal work, in clinical work, and also experimental cellular work. So that's something amazing, Doctor. Before I start taking the questions, I remind you again that you can write in the chat, or you can go to the designated area in the Q&A. Also, this talk is recorded. It's going to be posted on the website very soon, in our website, the alumni unit. كمان هو ترى بث مباشر على يوتيوب just in case, so it will be there. Whomever wants to go back to the same talk can go back to the College of Medicine YouTube channel وراح تلقونها إن شاء الله بإذن الله. Also, I've been asked about a certificate for this talk. This talk currently has no certificate, but inshallah, if we are to provide دورات تدريبية عن طريق الوحدة والتعاون أيضا مع المركز أو غيره, they will be, we're going to be providing certificates. So, Dr. Let me see if we have any hands. Otherwise, we have a question here from, Dr. Hassan. Go ahead, Dr. Hassan, تفضل. If you want to engage directly مع panelist. Can you unmute yourself, Dr. Hassan?
Well, just to mention, Dr. Maha, and feel free to write your questions, or even if you want to say it verbally. So,
نعم.
who doesn't want to talk, they can write it down, and we're happy to answer.
السلام عليكم.
عليكم السلام. تفضل دكتور.
شاكر لكم, الله يعطيكم ألف عافية. My question is it's a technical question. I have a proposal regarding the effect of diabetes on the different tissue in oral mucosa. So my question is, which model will be the best to conduct such a study? Is it mice or rats?
السلام عليكم. I would يعني أنا أفضل إنك تستخدم مثلاً الرات لأنه هو في حجم, طبعاً أنت you can use mice or rat. بس إحنا نفضل مثلاً الرات لأنه يستخدم في مثلاً 300 250 to 300 induction with the streptozotocin 75 milligram per kg. After 2 days they will be diabetic, and then they will lose they will have weight loss. عشان نحافظ على أقل mortality rate, إحنا لازم يعني إحنا نفضل نستخدم الرات. And you can use اللي هو المايس, وفي برضو genetically modified mice اللي هو non-obese diabetic mice ممكن تستخدمه بخصوص الديابيتك تايب 1. diabetic type 2 or 1 I don't know. أنت دكتور بالنسبة لك راح تستخدم diabetic type 1.
Diabetes type 1.
Diabetes type 1, we have streptozotocin model for induction, and we have genetically modified animal. You can use non-obese diabetic, or you can use the streptozotocin induction.
Okay, the STZ, I'm trying to use the something known as BB rats. I think it's genetically modified, and they get diabetes after 60 until 90 days. Is that correct?
12 weeks. After 12 weeks, they can develop the diabetic type 1.
So without using the STZ, I'm trying to avoid using the STZ.
Yeah, you can use the NOD mice. Nowadays, we have some strain. You can visit us and you can see the NOD mice. We have it nowadays.
Excellent. Thank you very much. Thank you.
Thank you very much.
يعطيكم العافية. There is a question in the chat from Dr. Filwa Zaid. She's asking if special surgeries for the brain is performed in the facility.
Good question. We do conduct I would say very advanced neurosurgical workshops with the collaboration of neurosurgery department or division within the college. And I'm not, I don't have the details of it, but they conduct very advanced cadaver, fresh cadavers surgeries that includes back, neck, head. I'm not sure if they do stereotypic brain lesion surgery or not, but maybe asking the office of the society is hosted here in the College of Medicine, and Mr. Sumaya or Ms. Sumaya might help us to answer that question, and I could get back to Dr. Filwa. But we do very advanced neurosurgery workshops, and that matches similar to what happens في يعني advanced experimental surgery centers across the world.
Thank you, Dr. Fahad. Let me take one question from the Q&A and then we go back to the hands as well. Here, this question from Dr. Sheikh Nawaz: how many diabetes and obesity rat model and type of rat strains are currently available in the animal center? Maybe you have touched on those, but maybe if you could remind us, please. He's asking about the diabetes and obesity rat model, as well as rat strains.
Hello, this is Dr. Muhammad Al-Mairfi. I think we only have one here in our lab. NOD mice, non-obese diabetic mice.
And we can help to provide, we've done for other researchers, if there is a specific type they want, we can help them to provide it. And also there is a logistical part of receiving it and getting the permissions and all of that. We can help with that process.
Perfect. Thank you. Dr. Hind Al-Ataibi, go ahead if you want to unmute yourself. Dr. Hind, or you can write it down if you can't.
Assalamu alaikum.
Alaikum assalam wa rahmatullahi.
Yeah, I was unable to. Thanks all for this great effort and knowing more about research resources, especially in basic part. I'm a dermatology consultant and I was attracted by the models you mentioned. I just have two questions about you mentioned skin pigmentation. In which type of disorder? Is it vitiligo or other? And what about skin cancer? Is it including cutaneous T-cell lymphoma animal model or not? Thank you so much.
Assalamu alaikum. For the pigmentation, usually we use guinea pigs, and we have the model for UV induction. We have lamp, and we exposure the guinea pigs for the UV for the dose for like 1 month. And then we have the pigmentation due to the skin color intensity. For the skin cancer, we have a genetically modified animal, and also we can we use some chemicals to induct on the skin. And now, right now, صراحة ما يحضرني الchemical because it's very long name. But you can visit us, and we can also.
You could be an non-melanoma, maybe skin cancer you are looking for.
According to the cell, actually for skin cancer, we use a cell line. We take it from the cell line, and we induct it. يعني احنا حقنها subcutaneously ويظهر عندنا السكين cancer.
Okay, we'll try to check with you inshallah later because cutaneous lymphoma is common in our community and important.
You are so
Thank
welcome.
you so much.
Thank you.
يعطيكم العافية. There is a question as well. I'm going to take it to a Q&A and then I go back to the chat. The portion of IRB maybe attracted attention. So the question is, when we have IRB, how long does it take to have the report all done and summarized to be sent? If you give an idea.
Luckily, two of our staff are members for the board حق IRB within the university. So maybe one of them can answer us.
الإجراءات أهلا دكتور محمد معيرفي مرة ثانية. أول شيء لازم نعرف في فرق بين الاي ار بي والايكوك. الاي ار بي هذه للتجربة للهيومن ترايل، هذه تكون في المستشفى هنا عندنا وخاصة في تجارب البشر. الايكوك هي مخصصة للانيمال ترايل، الإجراءاتها ما تأخذ شكل وقت طويل، يعني ممكن أسبوعين بالكثير والموافقة عندك يعني. وبرضو يعني زي ما قال الدكتور فهد، عندنا 2 موجودين في لجنة أخلاقيات البحوث الخاصة بالحيوانات، برضو راح يساعدونا في الإجراءات ويوجهونا ويوجهوكم وين تروحوا كيف تقدموا كل الإجراءات من A to Z. الدكتور عبد الله مبارك والدكتور ياسر الشواكر يساعدوك في الإجراءات من البداية إلين النهاية.
ومن المهم جدا انه يعني you meet with the team before you submit to avoid the delay, that you should make sure first read what's the requirement and also sit with someone who has been through this before to help you to know that what you have is complete or not, because they meet I would say every week or every 2 weeks, so you don't want to miss timelines or deadlines before your papers are not complete. So I would advise you to meet with the team and review your proposal before you submit it.
Perfect. Thank you very much. And also شكرا دكتور فهد, Dr. Mohammed as well, Mohammed Ma'arfi, for answering this question. We have a question here from Amjad al-Rashid. She's asking, the BB rat is not available nowadays. I tried to contact lab in the US in order to buy or purchase it, and they said they stopped breeding this model. So if you have any idea about the BB rat.
الدكتورة السلام عليكم. طبعا دكتور أمجاد الرشيد طالبة ماجستير، تم عمل بحث عندنا في المركز. صحيح هو البي بي رات it's not available nowadays في الجاكس في جاكسون lab and other labs. So we go for the non-obese diabetic mice and we provide them from outside, and we nowadays we have some mice here. So she's right. Nowadays we don't have there is no breeding for PP rat.
Shukran, Dr. Ahmed. Thank you for this amazing answer. There is the question here from Durria, Dr. Durria. She's asking about the spleen surgery regarding the diabetic type 1 model, if it's done, the spleen surgery.
For what type of animal?
She didn't mention the animal, but she talked about the model, diabetic type 1. Maybe Dr. Durria, if you specify which animal are you talking about?
And it will help with organ extraction at the end of the study.
Said, yeah, rat. She's talking about rat animal.
By the way, we have microscope for surgery, and for that rat and mice, it's very small organ in rat and mice. It's for spleen, and we can do the surgery with microscope, with our microscope. If she would love to visit us and see the microscope, and then we have vet also to do the surgery.
Great. There's a question from May. She's asking about if you have animal model for pulmonary hypertension.
For hypertension, we have diabetic type 1 model, and we have diabetic type 2 model, and we have the obesity model. And also we have some models that induction in kidney cause nephrotoxicity that affect the angiotensin converting enzyme and angiotensin system that caused that final goes for the hypertension.
Great, perfect. There's a question that I'm actually finding, well, to me, because I'm also advisor for students who are interested in research. From Rima Qahtani, I would like to thank you personally. She's asking about the medical students interested in being involved in research. Yes, we have students maybe in postgrad who are obligated to do research, but I'm actually in love with the students who like to do research because they either, okay, they may have a course, but some of them actually like to do also research. So what do you advise, Dr. Fahad and Dr. Ahmed, for those kinds of students who wish to be included in research and also work with you?
Thank you, Dr. Maha. I think we should encourage such behavior because society needs scientists, society needs researchers, and this is how we evolve in medicine and outside medicine. So it's good to see that there are people who are curious and would like to take this further and study this in the lab or even in the clinical research path. I think we encourage such behavior. And also in the center, we do have students who comes as volunteers, students who comes in the summertime. And also there is other way to be part of this, as you would collaborate with the researchers in the research to be an author in the specific research. So we in the center, we don't conduct our own research. We host it. So maybe we can use this venue and through المجلس الطلابي there is مبادرة المبادرات البحثية تطرح للطلاب للمشاركة فيها. أنا يعني advise students to go to that platform to see what are available, and also always يعني look around, talk to people who are interested in research. We have in the college lots of people who did experimental science research degrees. So maybe they're the one that they can help you to take this further. Also, you can support that with the field of interest. If you're interested in urology, for example, you could see who are the people who's working in the research in animal lab, and we can provide you the names. So you can go and talk to them and say, listen, I have that interest. Can I be part of this or that? I encourage such behavior, and we do have students comes around as part of research or even as part of volunteer. We welcome them all, and we're happy to host them.
Perfect. Thank you very much. I hope you heard that, Dr. Reem Al-Qahtani, and everybody who is interested from students. Also, I'd like to make it very clear, since I'm also responsible for the alumni unit, because we also have a question here. If you are an alumni, you can have this research collaboration as well, and we can help you, inshallah. Contact me. I have my personal information posted at the beginning of this presentation, and I'm also periodically pasting my info in chat for any inquiry in the future. Now, Dr. Maybe I have a question for you, Dr. Fahad, if I may. You are absolutely helping the faculty, students, and also people interested from the medical college. How about other colleges? Do you have experiences with that? يعني from scientific colleges, from other health colleges? And does that, in your opinion and experience, have created collaborations maybe?
Yes, actually, we work closely with the different stakeholders outside the umbrella of college, including مدينة الملك عبد العزيز، العلوم التقنية، KAUST, من جامعات مختلفة, different universities across the kingdom. Maybe Hisham, can you enlighten us and collaborate? What are the collaboration that we have with other entities outside the university? دكتور هشام معنا.
مرحبا دكتور. بالنسبه لداخل الجامعه دكتور، احنا احنا عندنا طلاب من علم الحيوان من كليه العلوم. And also Dr. Hisham here, he can also tell us about the other college that we have cooperation. Dr. Hisham, تفضل.
السلام عليكم. الطلاب اللي حضروا المركز من عدة كليات مثل كلية الرياضة وكلية الزراعة، مع العلم أنه يعني لديهم يعني مركز يعني تجارب، لكن الإمكانيات اللي عندنا تساعدهم يعني على إنهاء أبحاثهم داخل الجامعة. تقريبا أغلب الكليات، وكذلك من مدينة الملك عبد العزيز، وكذلك كليات البنات والمختبر المركزي تقريبا.
كل الشكر، يعطيكم العافية. شكرا دكتور هشام. There's a question about dental research. If you do dental opportunities, dental research opportunities in the center, and what extent to that do you do it?
نعم دكتورة، احنا عندنا طلاب كثير خلصوا طلاب البوست graduate student PhD or master degree. They finished their research in our center. Usually they use osteoporosis model, and also they use the beagle dogs and large animal for the dentist. And we have the ability to conduct their researches and to meet their objectives in our center.
Dr. Maha, I would use this opportunity to talk about the other part of the center. It's not the scope of this presentation, but just as
Go ahead, Dr. Go ahead.
People within the college or university. In the surgical part, we can host a very advanced surgical workshops, and usually this comes from societies of interest, or even department or division within the college or outside the college. And that part, for those people who are interested in surgical element, we could do another presentation another day, or as an overview what's being done and what are the planned activity, and we'll announce them ahead of time. So we do conduct basic and advanced research, hands-on training on big animals, and that and medical education, we moved from the era of see one, do one, teach one. Now we have to assure that our trainees reach a specific competency level before they work on patients, and we do provide such environment, and actually it's being implemented now as part of curriculum as a simulation setting.
Perfect. Thank you, Dr. Fahad. Actually, it seems some of the audience would like a way to contact the center or you personally. So if you wish to write this down in the chat, how to contact the center, if there is a phone number, email, or yourself. Maybe Dr. Fahad, you wish to do that in the chat for everyone to see?
Yes, I'll post them now, inshallah.
Perfect. Any more questions? If there is no more questions, then I'd like to remind you again about the form that I just pasted in the chat. It would be lovely to hear from you all. This is how we design the next, inshallah, programs. And this is how we help everybody and make connection between everyone. يعطيكم العافية. والدكتور فهد حاليا وضع التواصل اللي يريد انه يتواصل مع المركز. يعطيكم العافية جميعا. أحب أشكر دكتور فهد اليامي، دكتور أحمد المنيزل على ال wonderful talk today. You have done greatly, and I hope inshallah the audience have taken a great advantage of this, and some more inshallah to come. Thank you very much, everyone.
Thank you, Dr. Maha, and hopefully we help people to know what is available, and also we're always open for any suggestions, and also open for any support within the college or outside the college. With your efforts, will help to reach to a bigger portion of researchers within the college or outside the college. So thank you again, and I wish you all a happy day, and thank you, Mr. Ahmed and team, for your support. Well deserved, all of you. And I'd like to remind everyone here in the audience to look up the workshop that the center is offering very soon. Okay, this is the sign off for me, and you can look up the chat again if somebody want to take the contact information. شكرا جزيلا جميع، يعطيكم العافية، ونراكم إن شاء الله في فعاليتنا القادمة.